It's cold, it's January, you're looking around, everybody is sneezing and coughing and staying home from work, and you're thinking, this cold and flu season is getting worse by the day, right? Yeah, it is. New data from the CDC today shows influenza trends are growing or likely growing in at least 39 states. The CDC update comes despite the Trump administration's order for all federal health agencies to stop all external communications. It's a move some health officials say would make it hard to coordinate and identify emergency threats like bird flu. We want to bring in NBC News medical reporter Erica Edwards with more. Erica, walk us through here, right? The picture we're getting on how bad this influenza epidemic is. And I must say, I was surprised that we got the CDC data today. I didn't think we would.
You and me both, right? Remember, but I tell you, what we learned today was that we are now getting back up to about as how bad the flu season was before the holidays. Today, the CDC did release some data that flu cases are rising again across the country. As of January 18th, 25% of flu tests were coming back as positive, compared to less than 20% from the week before. What's more, the number of emergency room visits are also rising related to the flu. Young kids and older adults over age 65 make up the vast majority of ER visits and flu-related hospitalizations. Now, from what we can tell from the data we have so far, most cases are flu A strains, but flu B could also rise in the coming weeks. Remember, Tom, we still have about a month to go in this typical flu season. Tom?
Flu A is not as bad as flu B?
No expert will ever tell you that one strain is is worse than the other, because both strains are very unpredictable.
Can we talk about whatever is going on with the communications right now from the government, from the CDC, the NIH, the FDA, because the Trump administration had put a halt on all outgoing communications, and then we get this bit of data from the CDC. You and I both covered these agencies during COVID, during the pandemic, under the first Trump administration. And after a while, some of the information, people were suggesting, are the numbers being manipulated in some way? How are we supposed to read whether the data is going to be accurate?
Well, I could just tell you that we have to rely on the data that we're given. What's hard right now is that when we ask clarifying questions, follow-up questions to the CDC, the NIH, the FDA, as you mentioned, we're not getting those questions answered. So they're giving us little bits of data here and there. But again, we don't really have time for those follow-up questions to really address the concerns that you just brought up. So meanwhile, we have to really rely on other sources. Remember that most public health starts at local health departments, at state health departments, and they're really still the ones that have all that information. Experts are hoping this federal pause on national communications will be resolved within the next week.
Yeah, NBC News took to calling every single health department in every single state across the country to get accurate, down to the zip code data. Erica Edwards, one of the best in the biz. Erica, thank you very much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.